All right, this is the last section in chapter 5. Good job for making it this far. We are going to talk about common injuries and disorders of the muscles. A lot of these you probably have heard of. Maybe you have actually had a couple of these injuries, but you might not have known the name of it or the proper definition for it. But you are going to learn, and you will sound super smart that you know all of this information. So the first thing that you might have heard about is something called a strain. Basically, when you have a strain, this is when you have a muscle that is stretched beyond its limit. Therefore, it can't really return back to its original form and can get injured along the way. There are 3 types of strains that we are going to talk about. They have different grades. So grade 1 is the least serious, and then grade 3 is the most serious, and along with the types of grade comes with how long it takes to heal and just the condition of it as well. Obviously, people who are more flexible, more athletic, will have a lesser are going to be less prone to getting strains just because they have built up their body and their muscles to a point where the muscle is used to it. But say you are like me and haven't worked out in a very long time, and I decide to do a very intense activity, I might exhibit some strains in my body. So it really depends on how your body is made up of as well. So the first type of strain is called a grade 1 strain. This is going to be your most mild strain. This could be you don't really have any tears in your muscles. You just have some kind of like soreness, tightness in the area of the muscle that you have strained, and usually you can recover from this by a day or even less than a day. You might notice this. You might not even notice you have a strain in that muscle until you start to work it out again. But like I said, it's very mild and easy to recover from. Grade 2 strain, like it says, it's in between grade 1 and grade 3, so it's intermediate, moderate. You might have a little tiny tears in your muscles that where you have the strain in. You will need to rest it out so that you don't make it worse. But you will kind of be out of commission for a little bit. You will have weakness in that muscle area, tenderness in that muscle area, just an overall uncomfortable feeling. Grade 3, this is the most serious type of strain. This is when you have a lot more tear in your muscles. This can cause, it can be aggressive enough to cause bleeding and swelling. This definitely needs medical attention because you don't want it to get worse. And, a lot of people who have this type of strain usually get it in their hamstrings. And when you do, it's very slow to heal. It takes a lot of time. And the crazy thing is people who get these kinds of strains, if they don't let it heal properly, and even if they do, and say they kind of do the same activity again, they are more likely to get the same type of grade 3 strain in that same muscle, same location, up to a year after they have had the injury. So that's pretty crazy. There's something called contusions. Basically, this is when you have bleeding or bruising in a muscle because of some kind of impact that you've had, whether it's through a workout, maybe a strenuous activity, anything really, or just a sudden movement that you're not used to, or like a fall. But what the crazy thing is that if you have contusions and you get continually or repeatedly injured in that same area, you can actually develop another condition called myositis ossificans, which basically is when you have this weird calcium mass that forms in that muscle. It takes about 3 to 4 weeks for it to actually develop completely. What's even crazier is that about 6 to 7 weeks after it develops, it can actually, your body can actually absorb this material, this calcium mass, and it can disappear completely. There are cases where it doesn't appear completely and it can leave behind this like bony mass or bony lesion in your muscle, which can be kind of painful to deal with. Obviously, there are medical treatments you can get. Sometimes they will be able to go in and remove it or shave it off or whatever. But those are really things that can happen when you have contusions. Now, you might notice a pattern here, and as we further on to talking about other injuries, not just in this chapter, but in other chapters, that the main thing is when you have an injury, you need to rest. You need to take care of yourself. You need to heal. A lot of people say, oh, it's fine. It's just soreness. Oh, it's fine. It's just, a cramp or whatever. And they just keep going. And that's the worst thing you can do because your body needs time to heal. The best time for it to heal is actually when you're resting or you're sleeping at night. And if you're not doing that and you keep going and using that same muscle that is already injured, you're not going to be able to recover. And that's not going to be good because then you're going to have problems later on. All right. You might have heard of cramps. You might even have felt cramps, also known as Charlie horses. These are pretty much severe muscle spasms that are very, very painful. A lot of people have this throughout the day. Some people get it at night. And the sad thing is there's actually no known cause for it. There are things that people can relate cramps to that they say might be, the reason why you're getting it. For example, if you're low on potassium, magnesium, calcium, if you don't have enough water intake or electrolyte. That's why a lot of people, when they have sports, they drink Gatorade, not because it just tastes good, but it has a lot of salt content and also electrolytes. So when you do get cramps, be careful because sometimes if you get one cramp, you are more prone to get a couple within a time frame of that one cramp. Just rest and make sure that you are staying well hydrated. There's something called DOMS, which is a delayed onset of muscle soreness. This is like when you've done an extensive activity or like a workout and you're like, wow, I feel great the next day. Then the day after, you're like, why does my body feel like it's falling apart? Why does it hurt? And it's because of DOMS. It's basically when you have muscle pain or soreness after a rigorous activity, but it doesn't come and it doesn't actually show itself until a couple days after the activity. And what can happen is some people actually don't take it easy and they're like, oh, I feel great, and they just go and do more. And you're going to actually make it worse because DOMS is related to actual tears in your muscle tissue. You can have a lot of inflammation, pain, swelling, stiffness. And a lot of people, because it's delayed, they might think, oh, where did I get this? Why am I in so much pain? They don't realize it could actually be related to an activity you did a couple days ago. Tendonitis is something very common. Remember, your tendons are this tough, fibrous connective tissue that connects your muscles to your bones. So tendonitis is when you just have, pain or swelling in a specific area where you actually have your tendon. Your tendons get swollen. This can be done because you are overusing a specific type of muscle that you're not used to. It can be caused by just getting older. Diabetes and arthritis can actually cause tendonitis as well. Some common sites of, first of all, tendonitis can actually occur anywhere in your body. It's not specific to a specific area, but most people that deal with tendonitis will usually deal with it in their shoulder, elbow, wrist, your Achilles tendon, areas where you really have that tight pull of your muscle and your bone. The best way to treat tendonitis is something called RICE. You probably heard of it. It's rest, ice, compression, and elevation. That's what the abbreviations are for. There are anti-inflammatories to help the swelling go down. There's steroid injections, and obviously PT, which is physical therapy. There's also something called tendinosis. Tendinosis is when you have a chronic tendinitis. So if tendinitis is left untreated, it can become tendinosis. Basically what this is when you have your actual tendon that has these tears start to degrade. You have a long recovery that is ahead of you. It can take up to years. Your tendon can rupture, like it can literally pull off your bone. It can be very, very painful when this happens. So make sure you take care of it. Like I said before, this is Injuries like this are not something you should ignore. It's something that you should get treated and sought for medical help, especially if you notice that it's been lasting for a little bit longer than you're used to. Rotational injuries of the shoulder. Remember, your shoulder is one of your weakest joints, so you are prone to more injuries here. This can be due to repeated overhead motions at your shoulder joint, such as like throwing, sports that include throwing, volleyball, tennis. Swimmers get something called swimmer's shoulder. You can have tennis elbow. You have a lot of pain and stiffness. If you have some kind of improper mechanics or improper method you're doing, say you're like playing a sport and you're not having the right movements, this can cause this as well. Treatment, same thing, rest and ice. If you have a severe injury to your shoulder, like tears in your muscles and ligaments, you might need surgery for it. Epicondylitis, this is when you have tears and inflammation in your lateral and medial tendons of your elbow. This can also be known as tennis elbow, which is when you have this to your lateral epicondylitis, and then also little leaguer's elbow, which is when you have injury or inflammation to your medial epicondylitis. If these are left untreated, they can cause a lot of swelling, scarring of your tendons near your elbow, which can cause further damage later on in life. Just because it's called tennis elbow does not mean it's only from tennis players. It can happen in swimming, people who swim, people who use repetitive motion of their elbow as well. Shin splints. This is when you have, if you probably all experienced this at some point, but this is like sharp pain in your lower anterior leg. So this is where your tibia and your fibula are located. This is when you have pretty much like super tiny like damage to the tendons that are located there. And also to having inflammation to the periosteum of the tibia, which is like that outer membrane covering of that bone. And this can also occur in your soleus, tibialis anterior, extensor digitorum. So remember, soleus is in the lower back of your leg. We looked at this when we talked about lower leg muscles in the previous section. Your tibialis anterior, obviously this is in the front part of your tibia. And then your extensor digitorum is the lateral part of your lower leg. And this can happen with a lot of people who run, especially on hard surfaces, or like people who play tennis and they're not used to. I remember when I used to play tennis, I used to get this a lot, and it was very, very painful because it lasts a couple days. And if you don't take rest, it can get worse. Whiplash injuries. A lot of people get whiplash injuries. You might have heard when they have like car accidents. But I have a friend who got whiplash injury because she was walking her dog, didn't notice that the dog's leash was wrapped around her leg. She threw the ball. The dog went after the ball. She looked down, realized a second too late that she was completely wrapped around his leash. He went for the ball. She fell, and her pretty much her neck muscles went back very, very forcefully and suddenly, and she had whiplash to the point where she was having a hard time talking, severe headache, neck pain, and you can really this can be really serious injury to your cervical vertebrae, so you really have to be careful with this, and very dangerous. Muscular dystrophy, also known as MD, a lot of people struggle with this. This is an inherited disorder, so it's genetic. It can affect anybody. It can affect children, adults, and it can occur with some parts of your muscle in some areas, or it can occur in all of your muscles. And if you have severe muscular dystrophy, it actually usually starts off in your childhood. And it's really sad because a lot of kids who struggle with this, they do end up being in a wheelchair, and their life is either they don't survive to adulthood, or it's a hard struggle to get to that point. What are some symptoms that you can see in kids who have MD? They have intellectual stability, so they're not having good focus. They're not able to keep up with their age level in learning. They have a hard time doing simple tasks that another child their age would be able to do, which is whether, it might be like writing, running, walking, things like that. And you can also cause heart problems, which is really, really sad. There is no cure for it, but there are treatments to help with the symptoms. And that's even scarier because a lot of people who develop with it, it's kind of like they see it as their end of life sentence because no one has really come up with anything that can prevent this or completely cure it if you do get it. So just keep that in mind. Hernia, this is a very uncomfortable condition. This is when you really have these like protruding almost like balloon-like cavities in your abdominal area. Sometimes can actually occur in your groin area as well. And this can happen because you have some type of like hole or a weak section in your muscle that kind of balloons up. It can actually it can be caused by simple things like, say you like are lifting a heavy object and you're not doing it the correct way and you're applying too much pressure in one specific area, that can cause this to happen. A lot of people at birth can have a hernia, and they don't realize it because their symptoms don't show up, whether it's physical or internal, until later on in life. So it is something that a lot of people have, but they either notice right away or they might not. A lot of times when you have hernia, like I said, there are no symptoms for it. You just have a lot of discomfort. It can actually cause strangulation of tissue, which basically means that tissue has no blood supply to it. So it's pretty much dying. Therefore, it has necrosis, which is like death of that tissue. You can usually get surgery for it. A lot of people have gotten successful surgeries for it. But in males, those who get hernias in males, it's called inguinal hernia, and then females is femoral hernia. A little bit easier to remember, femoral females, and then inguinal is males. So that's just specific to the gender.